Dr. Padda, you mentioned the seed oils or vegetable oils. Can we talk about them a little bit more, please?
Sure.
What way do they cause inflammation, or do they make already existing inflammation worse?
They actually cause inflammation. And here's why. They're industrial seed oils. Industrial seed oils are a hyper-processed, refined oil that has a couple of unusual interactions. The thing is, what they do, they're called omega-6s. They stack beautifully. When you put them side by side, they cause a stacking effect to occur in the cell membrane. So it makes the cell membrane more rigid. And as you lose the fluidity of the cell membrane, it affects the receptors that are on the surface cell wall. And so it makes the receptors less active. And so independently of anything else, the loss of fluidity dramatically decreases the effect of receptors on the cell walls. Additionally, all of them. Yeah, because you change the fluidity. The receptors have to open and close within a fluid mosaic, a fluid bilayer mosaic. And if the fluid bilayer mosaic is more brick-like, you can't open and close the receptors as well. So that's issue one. Issue two is that the precursor for arachidonic acid is some of this omega-6 fatty acids. And so that's the pathway for prostaglandins, which is hyperinflammatory. And then the other problem is that much of the bigger problem probably is that much of the omega-6, you can't tell when it's rancid. See, the thing is that omega-3, when it's rancid, it smells like dead fish and you won't eat it. Omega-6, when it's rancid, doesn't have a flavor, and it becomes rancid with fluorescent lighting, with time, with a little bit of temperature. And so you'll end up eating rancid omega-6 and not realize it. And that is a polyunsaturated fatty acid with multiple cross linkages. And those multiple cross linkages affect lipid bilayers. They also cause fusing of the cell wall, and they trigger an inflammatory response. And so it causes, again, systemic inflammation. And it probably is, we know for fact that there's a strong association between vegetable oil aerosolized. So if I take vegetable oil and I aerosolized it, we know that is strongly associated with lung cancer. We've shown studies out of China where women in China who are non-smokers have a higher lung cancer rate than smokers in anywhere else in the world. That's because they're getting inhaled polyunsaturated fatty acid, which is rancid, and it's inhaled into their lungs, and that's how they're getting their cancer. And so we know it's a hyperinflammatory medium.
Is it also, so omega-6s, are they also obesogenic?
They are, through the course of the creation of insulin resistance and through the course of making your receptors non-functional. But independently, there's also a breakdown product it's a breakdown product that is akin to anandamide, and it breaks down into a compound that kind of gives you like the munchies that you would have if you were using marijuana. There's a compound very similar to that that's a breakdown product of omega-6.